Acute intermittent porphyria. It is a type of hepatic porphyrias. It is autosomally dominant mode of inheritance. The enzyme deficiency is UPG1 synthase or PBG deaminase. Accumulated products are aminolevulinic acid or porphobilinogen and porphobilinogen. And clinical features, these are the disease onsets after puberty. The patients experience acute abdominal pain and neuropsychiatric symptoms, which include sensory and motor disturbances, confusion and agitation. The most characteristic feature is these patients does not have photosensitivity, and this attack is precipitated on starving, and symptoms are decreased by high carbohydrate diet. Characteristic feature is there is increased excretion of ALA and PBG in urine. There is no color on voiding. On standing, urine gets darkened due to photooxidation of porphobilinogen to porphobilin. Next type is Porphyria cutaneous tarda, which is a type of hepatic porphyria again. The mode of inheritance is autosomal dominant. The enzyme deficiency is UPG decarboxylase, and the accumulated products are UPG1 and UPG3. Clinical features, there are blisters on skin exposed to sunlight. There is thin, fragile skin with redness, swelling, itching, and scarring. There is hyperpigmentation of the skin and increased hair growth on face. In contrast to acute intermittent porphyria, Porphyria cutaneous tarda, patients have more of cutaneous or photosensitive features. Characteristic feature is there is increased excretion of uroporphyrins in urine. So there is voiding of colored urine, which is in contrast to acute intermittent porphyria, there is no colored urine. This patient, the disease is also called as vampire disease because patients experience symptoms on exposure to light. Next type is congenital erythropoietic porphyria, which is a type of erythropoietic porphyria, and the mode of inheritance is also autosomal dominant. The enzyme deficient is UPG3 co-synthase, and the accumulated products are UPG1 and CPG1. Coming to the clinical features, these patients have erythrodontia, that is dark red colored bones and teeth. They also have cutaneous photosensitivity, that is repeated scarring will cause monkey face deformity, and repeated ulcerations and mutilation of ear, nose and cartilage will mimic leprosy. Characteristic feature is there is increased excretion of UPG1 and CPG1 in urine. So there is pink to red discoloration of urine, which is otherwise called as port wine appearance of urine. Next, ALA dehydratase deficient, which is a type of hepatic porphyria. The mode of inheritance is autosomal recessive, which is in contrast to other three types. Enzyme deficient, as the name suggests, the ALA dehydratase is the enzyme deficient, and accumulated products are ALA, that is delta aminolevulinic acid. Clinical feature is the patients have abdominal pain and neuropsychiatric symptoms in combination. Next, hereditary coproporphyria is a type of hepatic porphyria. The mode of inheritance is autosomal dominant. Enzyme deficient is CPG oxidase, and the accumulated products are coproporphyrinogen and precursors of ALA and PBG. So there is a combination of symptoms in these patients, that is acute abdominal pain, neuropsychiatric symptoms and cutaneous photosensitivity. Variegate porphyria, the type of porphyria is hepatic. Mode of inheritance is autosomal dominant. Enzyme deficiency is protoporphyrinogen oxidase. Accumulated products are protoporphyrinogen 9 and precursors of ALA and PBG. There is a combination of symptoms, that is abdominal pain, neuropsychiatric symptoms and cutaneous photosensitivity. And the last one is erythropoietic porphyria, which is also called as protoporphyria. It is a type of erythropoietic, and it is also an autosomal recessive type of disorder. Enzyme deficiency is ferrochelatase, and the accumulated product is protoporphyrin 9. These patients also experience abdominal pain, neuropsychiatric symptoms and cutaneous photosensitivity. So out of all these 7 types, acute intermittent porphyria, Porphyria cutaneous tarda and congenital erythropoietic porphyria are the most important and most common type of porphyrias that are seen, out of which The acute intermittent and porphyria cutanea are hepatic type, and congenital erythropoietic is erythropoietic type. Both erythropoietic type of porphyrias, that is congenital erythropoietic and protoporphyria, both of them are autosomal recessive type of disorders, whereas remaining all are autosomal dominant type of disorders. Whenever there is accumulation of ALA and PBG, there is new abdominal pain and neuropsychiatric symptoms, and wherever there is accumulation of porphobilinogens or uroporphyrins, your patients experience cutaneous photosensitivities.